Hi, and thank you for joining us for this week's Rise and Thrive with EHE Health, an interactive series where we will discuss all things health together. I'm Marianne Pepe-Tomlinson. I've been a certified medical assistant for 30 years. I've worked with EHE for almost 9 years now.
And I'm Dr.Becker, one of the physicians at the EHE Clinic in Morristown, New Jersey. And I've had the pleasure of working with Marianne and the rest of the team since 2019.
It's February, and February is American Heart Month. So today we'll be talking with Dr. Becker about the importance of good cardiovascular health.
Thank you, Marianne. I'm really glad we are shedding light on American Heart Month. This month helps raise awareness of heart disease, as well as reminding us of the importance of taking care of our hearts. One thing the CDC suggests when talking to patients about heart health is not to forget the ABCs. And what does that mean? It means basically remembering aspirin, blood pressure control, cholesterol management, and smoking cessation. These four behaviors can go a long way toward protecting yourself against heart disease. Although I must mention a caveat there. With aspirin, aspirin for primary cardiovascular prevention has recently been called into question based on recent studies that have come to the conclusion that the risk of aspirin use, such as gastrointestinal irritation, side effects, bleeding, outweighs its benefit. So there is some question still around aspirin for primary cardiovascular prevention. Not necessarily the case, though, for primary stroke prevention. That is still recommended, but it's a big one for cardiovascular prevention, and there's studies that are still ongoing regarding this issue. But definitely blood pressure control, cholesterol management, and smoking cessation are three of the main pillars of cardiovascular and heart health. Without question, preventing heart disease and stroke is incredibly important. Right now, they are the number 1 and number 5 causes of death, respectively, in the United States annually. So doing what you can every day to keep your heart healthy and strong can be instrumental in helping you live a longer and healthier life.
Dr. Becker, can you explain what is heart disease and what is a stroke?
Sure. Heart disease is a very serious health condition that keeps the heart or blood vessels from working properly. When our heart and blood vessels are working at their best, blood flows easily and is circulated throughout the body freely. If there's a clot or a clog or some type of obstruction in the blood vessels, or if our heart is not pumping blood properly or efficiently, this prevents blood from being delivered to many important parts of our body. Not having blood constantly delivered throughout our body can cause very serious illness and even death. Signs of heart disease or heart attack include things like chest discomfort. Some people might describe it as a squeezing or a tightness in the center of their chest or sitting on their chest. Some have used the term like an elephant sitting on my chest. There's also discomfort in different body parts, especially the upper body parts, such as the neck, the jaw, the arms, and radiation to these areas. Very specific, especially if it's to the jaw or the neck. That's very, very specific for the heart. And then there's also things like shortness of breath, of course, dizziness, faintness, things like that. A stroke is what they now refer to as a brain attack. A brain attack is the term used because it's really, in a sense, a heart attack in the brain. So that happens when a blood vessel that carries oxygen to the brain gets blocked or bursts. When that happens, blood can't deliver oxygen to part of the brain, and that part of the brain can actually start to die. Without the right medical attention, a stroke can cause major damage to the brain. People who have a stroke may have problems speaking, seeing, moving normally for a short amount of time or for the rest of their lives. Signs of a stroke include things like facial or oral drooping, so drooping of the mouth, arm weakness, leg weakness, speech difficulties, slurred speech. The prevalence of these conditions, in general, and of heart-related conditions in our country is staggering. For instance, nearly half of all US adults have clinical hypertension, also known as high blood pressure. That's why it's so important to know how to control it.
What exactly is hypertension?
Hypertension or high blood pressure is basically blood pressure that somebody has that is higher than normal, that it's higher than it should be. Your blood pressure changes throughout the day based on your activities. It also changes based on your emotional and mental status, your physical activities. Having blood pressure consistently above the normal range may result in a diagnosis of high blood pressure or hypertension. Now, what you might ask is the normal range. It used to be 120 over 80. However, and when I say 120 over 80, the top number, 120, is what's referred to as the systolic blood pressure. That's the active phase of the heart, or the pumping phase of the heart. And then the bottom number, the 80, is the resting or filling phase of the heart, which is between the heartbeats. However, recently, this has been adjusted where the normal is now considered to be less than 120 over less than 80. And that is, again, based on studies that have suggested that really 120 over 80 was too high for some people. And some people, even in that range, or even slightly above it, were having strokes and heart attacks. So again, less than 120 over less than 80 is now the new normal for blood pressure. Now, people can have high blood pressure for years without having any symptoms. It's referred to as a silent disease, such as cholesterol, diabetes. These are silent diseases because a lot of people say they feel absolutely fine. They have no symptoms whatsoever, unfortunately, until it's too late. Uncontrolled high blood pressure really increases very significantly your risk of serious health problems, including heart attack and stroke. Good news is that high blood pressure can be easily detected. And once you know you have high blood pressure, you can work with your doctor to control it. Now, things we do here at EHE in terms of preventive medicine, and that's the whole point of, our exams, our preventive exams, wellness exams, to try to prevent these things from occurring. That's primary prevention before the disease process is there. And especially in regards to high blood pressure, is reducing your intake of salt, reducing your intake of alcohol, keeping your weight healthy, a healthy weight range. Our exams at EHE concentrate on areas such as biometric screenings, such as your body mass index, body fat percentage, blood pressure, height, weight. These all go into different metrics that we use to try to find where a patient fits into which category, into which risk category they fit. And again, it again goes back to our principle here at EHE, which is how we eat, move, and think. These are ways that we can, these are different areas that we use to help modify our risk factors. And exercise, regular exercise on a daily basis, a diet that is a whole food, plant-based diet, stress management. These are all things that do affect our cardiovascular system, our cardiovascular health, including our blood pressure. And there's multitudes of studies that reinforce this. Once people see how their daily lifestyle choices can make a huge impact, they're really in a much better position to reduce their overall and comprehensive risk.
Understanding your risks and how lifestyle changes can help prevent them is key. Some risks are high blood pressure. Millions of Americans of all ages have high blood pressure, including millions of people in their 40s and 50s. About half of people with high blood pressure don't have it under control. Having uncontrolled high blood pressure is one of the biggest risks for heart disease and other harmful conditions such as stroke. High cholesterol. High cholesterol can increase the risk for heart disease. Having diabetes and or obesity, smoking, eating unhealthy foods, and not getting enough physical activity can all contribute to unhealthy cholesterol levels. Smoking. More than 35 million US adults are current smokers, and thousands of young people start smoking each day. Smoking damages the blood vessels and can cause heart disease. Other conditions and behaviors that affect your risk for heart disease include obesity, diabetes, physical inactivity, unhealthy eating patterns. Some ways to control your risks are: do not smoke. Smoking is the leading cause of preventable death in the United States. If you don't smoke, don't start. Make healthy eating changes. Eat food low in trans fat, saturated fat, added sugar, and sodium. An ideal diet is one that includes whole grains, fruits, vegetables, low-fat dairy products, poultry, fish, and nuts, while limiting sodium, sugary foods and beverages, and red meat. You also want to stay active. Get moving for at least 150 minutes per week. You can even break up the exercise into 10-minute blocks for a total of 30 minutes a day. Try riding a bike, swimming, gardening, dancing, walking, etc. Manage conditions. Work with your healthcare team to manage conditions such as high blood pressure and high cholesterol. This includes taking any medicines you may have been prescribed. Thank you all for joining us, and remember to continue to tune in for more Rise and Thrive episodes. Thank you.
And remember that the first Friday of every February, which is February 5th this year, is National Wear Red Day, where we encourage you to wear red in awareness of heart disease. In fact, I'd like to give a shout out to Dr. Seema Sarin, who is our EHE's Medical Director for Lifestyle Medicine. Her recent article in the EHE newsletter on National Wear Red Day, or the Go Red for Women campaign, the goal of which is to bring attention to heart disease as a leading cause of death for Americans, specifically the burden of heart disease on women's health in this country. Heart disease kills 1 in 3 women and is the #1 cause of death of women in the United States. And as per Dr. Sarin's report in the February EHE newsletter, almost twice as many women in the United States die of heart disease, stroke, and other cardiovascular diseases as from all forms of cancer combined. I would highly recommend reading Dr. Sarin's report, including the differences in warning signs of a heart attack that a woman may experience compared to a man's symptoms. I think we might have one question. Let's see. This says, you've outlined physical things a patient can do to reduce high blood pressure, but what can someone do if the high blood pressure is more mentally driven? That's a very, very good question. There's another question as well after that. So what can someone do if the high blood pressure is more mentally driven, or if it's more of, say, coming from stress or anxiety, things like that. There are actually now a plethora of things that can be done, some of which are actually apps you can get on your phone, including certain apps that deal with stress management, relaxation techniques, meditation, breathing exercises. So there's several apps out there that can be very useful for that. Also, exercise in and of itself is great for stress, anxiety. And again, they've done studies that have shown that exercise, physical activity, is extremely important for blood pressure that is related to all etiologies, including stress, anxiety. So there's a lot of things out there that can be done that can help with stress-induced high blood pressure. And they've been shown to be very effective through multiple studies. Let's see, another question. I've been diagnosed with high blood pressure. Are there any signs or symptoms that something more severe is about to happen to me? So basically, if you're diagnosed with high blood pressure, in terms of signs or symptoms that something more severe is about to happen, I imagine if you're talking about things like if you start developing severe headaches, they could be on one side, they can be both sides of your head. If you have visual disturbance, dizziness, lightheadedness, faintness, severe fatigue out of the ordinary. And if you notice that this correlates with your blood pressure, and that's why I always stress to my patients, it's very important to check your blood pressures yourself out of the office, which is probably more accurate than in the office, by the way, ambulatory blood pressure monitoring. And if you notice that your blood pressure seems to correlate with headaches and visual disturbance, that's extremely important to be seen by your doctor very, very promptly, because that could suggest that there could be an impending event, such as a stroke or some type of other medical emergency that could be evolving, some type of process that could be evolving. Let's see if there's any other questions. Okay, there is another question. What is a heart healthy diet? Is it okay to eat something that is not heart healthy? What are some ways to eat healthy when I go to a restaurant? So again, these are all excellent questions. And again, a heart healthy diet, again, we talk about at EHE, we like a whole food plant-based diet. So we really suggest plants, fruits, vegetables, grains, try to limit your processed foods, try to limit your fats and the different types of fats, such as trans fats, certain types of saturated fats. And you want to stick to lean meats and things like that. And you can eat healthy at restaurants. It's harder sometimes, depending on the restaurant you go to and how often you go out to eat, because again, you're dealing a lot of times with larger portions and with more chances for unhealthy food choices. But again, if you stick to the basic principles of like a Mediterranean diet, again, focusing on more vegetables, beans, nuts, and again, it all comes back to the same caveat of portion control with all of this. But if you stick to a whole food, plant-based diet, that's a very good diet that should help with blood pressure, and also healthy weight maintenance. And again, studies have backed this up. Multiple studies have backed up this information, and continue to evolve on this very subject. So that's just a small portion of the type of diet that you can get at restaurants, and also that you can try to stick to for heart health and for blood pressure. Again, limiting sodium intake. You definitely want to stick to less than 2,000 milligrams a day. And again, watch your fats, and that should help. And again, keeping an eye on your blood pressure out of the office is probably the most important way to monitor your blood pressure and to help your doctor help you. Again, thank you for joining us for this Rise and Thrive. And we look forward to seeing you again in the near future. Take care.